In policy and budgeting decisions, you need to convince decision makers with evidence. Now, what counts as evidence? Traditionally, evidence means hard facts and figures, such as data from research studies. But what about the lived experiences of women? What if we ask them what they need and shape policies and budgets around their responses? After all, women know best the circumstances of their lives and what is needed to improve them. While true, this concept is almost completely unheard of, especially in Pakistan, a country with deeply entrenched patriarchal norms and a family planning sector that remains largely devoid of mechanisms to engage women in policy and planning. This has never been felt more strongly than now, when 1/3 of the country lies flooded. In times of crisis, it is the women and girls who are affected the most, but whose voice and needs are addressed the least. That is why, at the Forum for Safe Motherhood, we set out to change the way policy is shaped with a simple approach. Ask, listen, act. Ask women and girls what they want. Don't give them a prescribed list to select an option from. Let them respond in their own words. Listen. Deeply listen to their concerns and ideas for change. And act. Meaningfully act on what they say and galvanize others to do the same. The strategy was straightforward, yet the impact that it created was overwhelming. Now, let me begin by telling you how we identified women's key asks. In 2018, the Forum for Safe Motherhood was part of a global campaign called What Women Want. Launched by the White Women Alliance, the campaign asked more than 1 million women and girls worldwide about their top request for their reproductive health. Nearly 250,000 responses came from Pakistan alone, with family planning services, supplies, and information emerging as the top request. Using women's voices as evidence, Forum for Safe Motherhood embarked on an advocacy initiative in 2 provinces of Pakistan, Sindh and Khyber Pakhtunkhwa, to improve the enabling environment for family planning. Next, we listened. It was not just us listening, but also decision makers. We developed an innovative mechanism called listening sessions. Now, these are meetings where government officials become the audience and women have an opportunity to share their experiences and perspectives. The forum implemented these sessions in Sindh and Khyber Pakhtunkhwa provinces, alongside traditional activities such as policy landscaping and budget analysis, policy dialogues, and strategic media outreach. Then we convinced decision makers to act. After listening to women's stories, women and decision makers crafted family planning policy and delivery solutions together. The listening sessions help decision makers to identify policy priorities at the provincial level and catalyze change at the district level by improving local service delivery through women-led solutions. Listening sessions have since become a leading mechanism to engage women in family planning decisions. The government of Sindh realized their utility as a platform for women to share their family planning challenges and demands directly with decision makers, and adopted listening sessions in its FP 2030 roadmap. This was the first time a citizen-led accountability process has been included in a government's family planning service delivery mechanism. Women's voices have also been the evidence needed by decision makers to direct family planning resources to effectively address women's needs. In 2020, Khyber Pakhtunkhwa province reduced its family planning budget to address COVID-19. Using women's demands for more accessible and available family planning services as evidence, convinced the provincial government to increase the family planning budget by $8.5 million for the year 2021. But securing increased funding is only a small part of the battle. There are often large discrepancies between what a government budgets for and what it actually spends. Earlier this year, women's demands for more contraceptives held decision makers accountable to spend the newly allocated funds. Women's voices are the change makers, whether it is improving family planning policies, mobilizing domestic resources, or strengthening accountability mechanisms. For governments to fulfill their bold commitments to FP 2030, investments in women's voices and demand initiatives is the way forward. Listening to women is a revolutionary place to start. We have done so in Pakistan. Now, it is your turn to ask, listen, and act alongside us.